Closed chain hip traction. There's a couple ways that we can do this. I prefer the one that I'm going to demo here in standing with an RDL or a hinge. I use this a lot for clients that have a feeling of tightness in the front of their hip or confirmed impingement in their hip. While I am a physical therapist, there is a caveat here that if you are having hip pain, don't just throw things at it. If you're not actively seeing a medical professional, you should do so, but this might be something that can help tide you over in the meantime. So using a road band, preferably a thicker one because you're going to want a little bit more traction. You're going to anchor it on something stable behind you. You're going to slip the leg in that feels tight or stuck in the front of the hip, and you're going to bring that band up right into that groin crease. You're then going to step far enough forward that you feel like the band is trying to pull you back, and you're going to stay anchored on the floor, find your brace, and then drive into that hinge. Okay? I prefer the hinge because it's an easier motion to maintain that posterior hip traction on, but you can also do this with a squat. So if a squat is something that's bothering you, you can do a warm-up with a band in the same position, and you just drop it down. You might need to stand a little bit further to make sure you're maintaining that tension all the way through the squat. And typically for individuals that are dealing with hip impingement or feeling too tight in the hips in their squats, you're going to want a slight increase in your toe turnout, right? So that knee tracks outward, hip joint opens up a little bit more. So you can turn your toes out. There's a big push to always keep your feet straight. Not everybody's built that way. If your toes are turning out, just make sure that knee is tracking over that second and third toe, and then you're still maintaining good alignment even with the turnout.